The lecture on this week focuses on the applications of TMS in psychiatry. You may follow our social media. We will upload our lectures on YouTube channel. Now let's start the training. And first, we will have a brief introduction to TMS. What is TMS? It is transcranial magnetic stimulation, which uses a time-verifying pulsed magnetic field, which can form an induced electric field and generate induced currents in the brain. Thus, the brain tissue is stimulated, and the whole process is non-invasively penetrate the skull. And TMS is also one of the 4 brain science and technologies in the 21st century. And rTMS has been approved in the treatment of refractory depression by Health Canada and FDA. So this is the main application fields of TMS, and I haven't put all of the fields in here, and today's focus is psychiatry, and you may looking forward to our future lectures about these fields. And for psychiatry, it is mainly used in major depressive disorder, obsessive compulsive disorder, substance dependence, generalized anxiety disorder, panic disorder, bipolar disorder, PTSD, schizophrenia, sleep disorder, and so on. And the first 3 applications has been approved by FDA. And in the second part, I will introduce some international application progress of TMS to let you know that TMS has been accepted around the world. And first, TMS is applicated in mood disorder, especially for depression, as early as 1995. And this is the study shows. And after that, the transcranial magnetic stimulation in clinical psychiatry is published by American Psychiatric Association, which offers practical guidance for clinicians using TMS and refers their patients to have TMS done, and updates the fields for neuroscientists and neurologists. And for FDA, they have approved many TMS applications in MDD, OCD, treatment-resistant depression, smoking addiction, and decreasing anxiety symptoms in depressed patients. And these symptoms or these indications are the main diseases for in psychiatry department. And this is the evidence-based guidelines for rTMS, which is an updation. And the highlight in this guidelines shows that TMS has a higher efficacy in the areas of depression, pain, post-acute motor stroke, and rTMS can produce significant clinical improvement in various neurological and psychiatric disorders. And this update mainly includes that studies published in 2014 and 2018. And these are the safety guidelines in 2009 and 2020. And this is an update of the 2009 safety guidelines, taking into account the safety of new technologies and equipment and providing operational guidelines for the future use of TMS. So TMS is safe and its safety is guaranteed by these guidelines. And in 2016, Canadian Network for Mood and Anxiety Treatments has released the clinical guidelines for the management of adults with major depressive disorder. And rTMS is recommended as a first-line treatment for patients with MDD who have failed at least one antidepressant. And The Clinical TMS Society in USA, which is created by a group of leading TMS clinical providers and researchers, and they have introduced prefrontal TMS therapy for repeatedly used for patients with MDD. And this is a German guidelines for the use of rTMS in depression, and it is published in this month. And as you can see on the biological psychiatry, as you can see, TMS has been accepted worldwide. And this is an expert consensus of China. And in this consensus, they have introduced the safety and effectiveness of clinical rTMS treatment, and they have standardized the treatment process and operation of TMS. So this is these two videos shows how TMS technology applied in China. As you can see from these two videos, TMS has been used a lot in China, and one hospital may have many tables of TMS machine. And in this part, we will introduce some applications in psychiatry of TMS, and we will explain more about depression and OCD. As for depression, it is a common mental illness which has a high incidence and a high risk of suicide. And depression is the leading cause of disability worldwide, according to the UN, and more than 300 million of global population suffers from depression by WHO, and it has an 18% of increase between 2005 to 2015. And 76% to 85% of patients in low and middle income countries do not receive treatment at all. And the basic barriers to these patients may be inaccurate assessment, lack of trained healthcare providers, and social stigma, and lack of clinical resources. And depression is a major mental health cause of disease burden. And current treatments for depression has its own limitations. For medication, the fluoxetine is used a lot. It is a kind of SSRI, and the SNRIs are used a lot too. And 30% of depression patients may develop to refractory depression after failed antidepressant treatment. And the medication has certain side effects including inducing mania, suicide, and it may work slowly. For psychotherapy, it has a slow onset and usually causing a long time for the treatment, and it has a high cost. And as for the electroconvulsive therapy, ECT, it is recommended as a second-line treatment, but it has certain side effects, including memory loss, high risk of inducing epilepsy, and so on. And it has a poor patient acceptance for this adverse effects, and it is poorly targeted, and it has a troublesome operation it may cause great pain on patients, so it may need anesthesia. And compared to those therapies, TMS is first, it is affordable and it is recommended by FDA and CNMAT to use, especially for those patients who has no response to antidepressant, and it has a fast onset. And FDA recommends 4 to 6 weeks, which is 20 to 30 sessions. for patients who are not responded to antidepressant. And this occurring treatment time vary with each individual. And it is reported in literature that TMS can help in improving cognitive function. It is safe, for it has an international safety guidelines to protect and guarantee the safety of the patients and the doctors. And it is easier to use TMS to treat depression, for it has a unified therapeutic target and it has no troublesome preparation. And how TMS works on treating depression. So this is the left DLPFC. This is the right DLPFC. DLPFC stands for the dorsolateral prefrontal cortex, and the LDLPFC related to positive emotions according to many meta-analyses. And patients with depression may have abnormally weakened function in LDLPFC, and the RDLPFC related to negative emotions, and patients with depression may have abnormally enhanced activities in RDLPFC. And anterior cingulate cortex and the posterior cingulate cortex, the ACC, the PCC, has functionally connected to DLPFC, and depressed patients have abnormal activities in ACC and PCC. And TMS may have certain effects on the cerebral blood flow and metabolism and some neurotransmitters and its descending pathways. So this picture shows the dopamine pathways and the serotonin pathways, which may have some certain effects on depression patients. And this is the FDA-approved TMS protocols for treatment of depression. And as you can see, both the rTMS or the TBS has been approved for depression. And for the rTMS, it may cause at least dozens of minutes. And for the TBS, it only needs 3 minutes to achieve the same effect to the rTMS. And as you can see, the intensity is relatively low, so it may be more safe than the conventional treatment. And this is a literature case of TMS in the treatment of depression. And this is the basic information of the subjects. And as you can see in this picture, it shows that a significant reduction in this HRSD score, which related to the depression symptoms of patients. And as you can see, the 10 Hz rTMS and ITBS can achieve the same effect at the end of the treatment. And the effectiveness of ITBS, it is no inferior to the 10 Hz rTMS for the treatment of depression. And they have a similar side effects, safety and tolerability. Both treatments have low numbers of dropouts. And by using of TBS, the number of patients treated per day with current rTMS devices can be increased several times without compromising clinical effectiveness. And this is the protocols used in this study. Both of the two protocol uses a figure of 8 coil to stimulate the left DLPFC. And for TMS used on special population, children with cerebral palsy, autism, and other diseases, it is safe and effective and has no serious adverse effects. And for those adolescents, it is safe and effective. Again, it has no serious adverse effects has been reported currently. And for late pregnancy, especially for low frequency, TMS is safe and effective, has no special harm to the baby. And for the senile depression patients, we need to pay attention to their skull cortex distance to adjust the intensity of stimulation. And the obsessive compulsive disorder, OCD, is a mental and behavioral disorder. These are some typical symptoms of OCD for excessive hand washing or keep checking the door. Obsession means certain repeated thoughts and compulsions is feels the need to perform certain routines repeatedly, and it can to an extent that distress or inspires one's general functioning, and the patients are unable to control their thoughts and activities. Their daily life is negatively affected, and these behaviors often taking up more than an hour a day. And OCD occurs, as you can see in this picture, worldwide, and OCD affects about 2.3% of people at some point in their life, with an annual rate about 1.2%. And the condition may associated with tics, anxiety disorder, and an increased risk of suicide. So the clinical treatment of OCD has always been a problem in psychiatry. And for the CBT, which is a psychotherapy, the exposure and the response prevention, ERP, is used a lot. Exposure means to teach the person to deliberately come into contact with the situations that trigger the obsessive thoughts and fears. And then the response prevention means that although they have these thoughts and fears, they have no actual actions to carry out these usual compulsive acts. So gradually, the patients are learning to tolerate the discomfort and anxiety and not performing the ritualistic behavior. But CBT has a low acceptance, and 25% of OCD patients do not follow CBT treatment. And CBT is also a high-cost therapy, and it is generally used in combination with drugs, and most patients cannot complete CBT treatment. And for medication, the SSRI, clomiprophen, and antipsychotics, which is used when there was no improvement with SSRI treatment. It has a less useful when used alone, these medications, and 40% to 60% of patients still have no significant effect after taking the drug or cannot tolerate the adverse drug effect. And as for the ECT, which may be the last resort if a patient has no response to any of the medication or the psychotherapy, and ECT has certain adverse side effects, and we have mentioned before in depression, and it may cause memory loss and nausea, vomiting, and all these indications must be carefully managed. And for TMS, it is approved by FDA in the treatment of OCD. And FDA has reviewed 100 patients, and their OCD symptoms is evaluated by YBOCS score, and it shows a good remission rate. So FDA recommended to use a double concoil to treat the dorsomedial prefrontal cortex with a 20 Hz frequency. And the total treatment time only needs 18 minutes. So this is a literature case of OCD, and this is a basic info of the subject. And as you can see in this picture, compared to the sham treatment group, the active group has achieved more score reduction. And as a result, 89% of the active treatment group and 96% of the sham treatment group completed the study. The reduction in YBOCS score, as for the DTMS treatment, which is the active treatment group, was significantly greater than the sham group. And at the 1 month follow-up, the response rates were 45% in the active treatment group compared to only 70% in the sham treatment group. And here they concluded that the high-frequency DTMS over the MPFC and ACC significantly improved OCD symptoms, and TMS is a potential intervention for patients who do not respond adequately to pharmacological and psychological interventions. And the stimulation site here is the MPFC and ACC. So this is another case study about OCD, and they have choose 10 OCD patients and uses the YBOCS to evaluate their improvement, and the whole treatment uses 10 days, and the result is that all patients demonstrated improvement in their OCD symptoms after 10 sessions of RTMS, and the improvement persisted 1 month following the last session of RTMS, as you can see in this graph, that whether after 2 weeks or after 6 weeks, the improvement can be reserved. And they draw a conclusion that low-frequency deep RTMS can be a promising and robust intervention in OCD symptom reduction. And this is the protocol used in this study. They use a double coil to stimulate the MPFC with 1 Hz frequency. So this is an application case of the alcohol dependence. They choose 45 patients with alcohol dependence syndrome. And the results shows a significant reduction in their ACQ, NOW total score, and factor scores in the group collected active RTMS compared to the sham stimulation. They draw conclusions that RTMS was to found to have a significant anti-craving effects in alcohol dependence. And the coil used here is a figure of 8 coil to stimulate the red DLPFC. And for patients with generalized anxiety disorder, and this study has chosen 25 patients with GED at least moderate severity, and they have come to a result that the response and remission rate were higher in the active groups compared to the sham TMS group. And only for the active RTMS group, their right DLPFC activation during a decision-making gambling task increased at post-treatment, and changes in their neural activation correlated significantly with changes in worry symptoms. And we can draw conclusions that RTMS may improve GAD symptoms in association with modifying neural activity in the stimulation site. They use a figure of 8 coil to stimulate the right DLPFC. And this is also the results shows in that study of the generalized anxiety disorder. As you can see, compared to the pre-treatment scores, their post-treatment scores has a significant reduction. And when TMS is applied in schizophrenia, some patients may have treatment refractory auditory hallucinations. And there are 39 patients and treated for 10 days. And their symptoms were evaluated by these 4 scores. And they have choose a figure of 8 coil to stimulate the temporal area. And as you can see in this graph, they have shows a significant effect than the sham TMS group. And this study suggests that 10 days of low-frequency RTMS applied daily for 20 minutes to either temporal cortex significantly reduces the symptoms in patients with schizophrenia who are having refractory auditory hallucinations. And the left-sided RTMS has similar effects with the right RTMS. And as for patients with post-traumatic stress disorder, PTSD, and this study has chosen 65 veterans with current combat-related PTSD symptoms, and they're using bilateral RTMS and also the unilateral right RTMS, and compared to the sham RTMS group, and simulated the DLPFC. The results has shown a significant difference among the three groups, and patients demonstrated significant PTSD symptom reductions in the bilateral group compared to the sham TMS group, and there was no significant differences between the bilateral and the unilateral right groups at the end point. So we can draw conclusions that the bilateral and the unilateral right RTMS are superior to sham RTMS, but does not support the hypothesis that the bilateral RTMS is more effective than the unilateral. So next we will review the effective clinical TMS protocols together. So this is the recommendation from the evidence-based guidelines on the therapeutic use of RTMS by IFCN. So as we can see that they have recommended for depression, PTSD, depression, OCD, addiction, craving, schizophrenia by using either RTMS or TBS. So this is the protocols provided by expert consensus from China. And this is the evidence-based protocols from many high score literatures. And this is the experimental protocols from Shenzhen People's Hospital. And this is the Shenzhen People's Hospital. They're really authoritative and has a rich TMS clinical experience. And they have an annual outpatient volume of more than 100,000 patients. So this is how YINGCHI TMS is used in Shenzhen People's Hospital. So this is another experiential protocols from West China Hospital. And this is West China Hospital, and this is main editor Dr. Zheng Zhong of that protocol. And he has more than 14 years of treatment experiences with TMS and has done more than 150,000 TMS treatments. And they have used YINGCHI TMS stimulators. So as for the TMS tools for the therapeutic use of psychiatry, it needs to have a strong cooled system. And we're the only one TMS manufacturer with both air cooling and liquid cooling technologies. And we have a modern design and relies on the ergonomics. And we have unique design, user-friendly, quick steam software, and our stimulator has embedded software and 5 predefined treatment protocol buttons and pre-stored patient's information. And our super efficient cooling system enables daily intensive treatment with a large patient flow. And we have quick after-sales service and efficient training. So for the coils choose for psychiatry, for the flat figure of 8 coil, it is well focused, and it is also the conventional coil used for depression treatment. But for the angulated and double cone coil, they can focus more deeper and has a ergonomical shape design. And as you can see in this graph, it can stimulate more deeper. And we also have some unique designs for YINGCHI TMS coils, where the coils is light-weighted, so it is easy to handle, and it is designed with the intensity adjustment buttons and LCD and single pass button, it is easy to adjust the motor the intensity and to test the motor threshold better. And we have a pulse counter, which can test the remaining pulses and to monitor the remaining pulses easily. So why do we need better design matter? As you can see in this picture, with a lighter weight, it is easy to use and its ergonomical shape can have a better contact to the brain of the patients. And as for the figure of 8 coil we have mentioned before, it is a conventional coil for depression, and it can induce an electrical field, is restricted to superficial cortical targets due to its rapid attenuation in depth. So it can stimulate at a depth of 2.5 centimeters. But for double cone coil, it shows to induce a higher and wider spread electrical fields that have better ability to stimulate deep brain regions. And it can still stimulate a depth of 4 centimeters. And why do we need, and what does the best balance of focality and depth mean to patients? So we have mentioned before that as for the depression and OCD, this ACC, PCC, and PFC is some related brain areas. And as we can see, it lies in a deeper area of the brain. So the deeper brain area related to the psychiatric disorders, when they are stimulated, they can hurt less and they can let the patients benefit earlier. And compared with the flat figure of 8 coil, the patients may also have a lower motor threshold using a double cone coil, and for those experienced treatment tolerability issues at higher MTs, the double cone coil could reduce scale pain. And the deeper stimulation is related to these deeper brain areas. And these are some customers' feedback about YINGCHI double cone coil. And the patients have said that it can make their patients benefit earlier, and it has a better contact to the brain of the patients. And they have also expressed their thanks to the double cone coil, and they are hoping to use the double cone coil in other symptoms like schizophrenia with auditory hallucinations, OCD, and other fields. And these are the references from for this presentation, and I have attached most of the references in the corresponding page, but these are the references with no space to attach to the corresponding pages. And that's all for my lecture.